Certainly there's been benefit. Our queue has come down considerably by AutoAuth. We do need to beef up the back end, so monitoring and auditing. But we found that most of our providers are not problem providers, right? I think most people want to do the right thing. You do have those occasional people in medicine, just like you do in any other field, that are probably going to skirt whatever rules you'd put in place. But that's why you can put business rules on the back end for those things where you may need to police certain things differently. But for the most part, most providers really want to do the right thing. And I think where it comes to radiology, right, there was a big push from Medicare to make sure people were utilizing that because there's radiation involved, right, with radiology tests. So there is, even though we don't think of every test having a risk of harm, there is some risk of harm. So, I think MCG has helped us incorporate that on the front end so people can get an automated decision. And so, over 35% of the time they get an automated decision and it does not have to pend. We do have a couple of guidelines which we've customized. Very few and far between. We try not to customize if we don't have to. So it's just been, really I can count them on one hand what we've had to customize. For the most part, we've used MCG. Brandy met with us and on the clinical side to help us. And honestly, you walk through it 2 or 3 times and it's pretty intuitive and easy to do. So once we were led through it a couple of times, our advanced imaging team was able to get everything done, within a period of a couple of months. Really, it's the IT connections that took a little bit more time, and I can't really speak to that piece, but the customization piece, pretty easy to integrate into AutoAuth.